Oh, this talk about socialism. That's exactly what we heard when Medicare was suggested. In fact, Ronald Reagan was the lobbyist who went around the country against Medicare because it was socialism. I don't know about the VA. That sounds like a socialist system to me, too. That is a single-payer system provided for our veterans. Social Security, oh my, that is definitely socialism, according to my Republican colleagues. And a single-payer system would not be any more socialism than any of those current government-run programs that people like. And in fact, the idea of Medicare for All is really popular out there. It polls really well. Be careful of your slams against socialism. People want to have health care. The United States of America currently pays more for health care than any other country. Is that right, Mr. Hadley?
Yes, that's correct, both on a per capita basis and as a percent of GDP.
Thank you. And isn't it also true that in terms of outcomes, we are lower than most of the industrial countries in the world? Is that also true? Longevity. Let's talk about maternal mortality. Is that true?
So for longevity, yes, among the OECD countries, the United States is below.
We're the only industrialized country where actually our maternal mortality has gone up instead of down. Is that not true? It is true.
Correct.
So we need a bold plan here. And I am on every bill to improve health care. I've been for Medicare for All since many of you have been born. But I'm also the co-sponsor of Medicare for America. I helped write the Affordable Care Act. I'm for improving it. I'm for all the plans because what we have now is not working. My colleagues talk about wait lists. But your report, Mr. Hadley, showed that 29 million Americans are uninsured right now. They're not even in line. So there are people who never are going to get the kind of care that they need right now if they can't pay out of pocket. Isn't that true?
That's correct. Although they do seek care through other sources, charity care, and so there can be some uncompensated care. But more generally, there are also people who have insurance that forego medical care because they can't afford the out-of-pocket.
A lot of people. So people are waiting 5 weeks, 5 months, or whatever you said about Canada. How about your entire life waiting? Because we see people die. And in fact, before the Affordable Care Act came in and Medicaid expansion came in, people were actually dying. And when we opened it up, we saw people who had stage 4 cancer because they had avoided going to the doctor. There was a really bad editorial yesterday, I thought, by Mr. Scalise, talking about how bad a Medicare for All system would be. What effect would that have if we had Medicare for All on women's health care and the full range of reproductive services? Someone answer that?
So it depends critically on the design of the system and the services you choose to cover. So in the context of a single payer system, we lay out those as design choices, but we haven't analyzed any of the specific proposals.
Okay. Did you want to say anything?
Yes, well, the uninsured women would then get access to coverage and benefits, so that would be an improvement.
I mean, we have, before the Affordable Care Act, being a woman was a pre-existing condition. I also just wanted to say to my colleagues, the idea of choice. You know what? Americans don't love picking an insurance company. They don't love insurance companies. Americans want a full comprehensive package of benefits. You say they want to choose benefits? No, they want to know that those benefits are there. What Americans want is a choice of doctor. And what I heard you say, Mr. Hadley, was that if there were Medicare for All, there actually might be more choices of providers. Is that right?
That's correct. As you can imagine, that all of the different networks that exist today would be sort of combined so that all of the providers would participate and be potentially available.
I yield back.